When would you do an angioplasty versus a full bypass that you would do?
Yeah, so that's a source of confusion. There's two specialists. One is a surgeon, like myself, and then the other one is a medicine doctor, which is a cardiologist, and their training is completely separate. Mm. So the cardiologists are able to string wires up into the coronary itself and put in stents, which are little metal cages that prop open the artery
They pop open and open up these partial blockages.
Yeah.
And how about when they put balloons in there? Is that called angioplasty?
That's called angioplasty. Usually they're both done at the same time. So you're using a balloon to stretch out the stent, or you're ballooning before you place the stent, or the stent's mounted on a balloon.
So would you be when would you be called in to do something when it's so bad that you can't do it? It's a bigger blockage?
Yeah, everybody wants catheterization and stent. That's because it's simple, easy. It's an overnight stay. It's a puncture wound in the wrist or the groin, either way. But if there's so many blockages in a lot of places, and if the blockages are especially at the most important artery in the front of the artery called the left anterior descending artery, the LAD,
okay,
which feeds a lot of the pumping chamber.
That's the big feeder.
The big feeder,
okay,
or something called left main, which is the widowmaker. That's the artery that not only feeds the LAD, the artery in the front, it also feeds the circumflex, which is the artery on the side.
Okay.
Or if you're diabetic, and the diabetics sometimes don't take the stents very well, they re-block them.
Okay.
So basically, if you come in and you have blockages, multiple blockages, you're healthy enough to live 5 years. So we wouldn't consider it necessarily in a 95-year-old, but you're going to live 5 years or more. And your blockages are bad enough in multiple areas that you would require multiple stents. If it's a left main, widowmaker, or proximal, or close to the front of the artery, the LAD, okay. Or if you've already suffered heart attacks where your heart's weakened, then we prefer bypass.
Okay.
The reason is bypass is a huge risk up front. It's open heart surgery.
Gotcha.
But
now let's say what open heart surgery is. They make an incision in the skin. You take a saw and you go through the breastbone. You cut the breastbone in half, and you pry it open. You've got these retractors that hold it open and expose the heart and the whole center of the chest.
Yes.
Yeah. So I can see it because that's a big upfront surgery to get there.
Yes.
But then you can do more repair once you're there.
You get more blood supply to more parts. You can do a quadruple that get parts to all. You can do 5 bypasses if you had to, but you'd get blood supply all parts of the heart, and it's more durable, less likely that you would need further down the road. And the real catch is it's more likely to preserve the strength of the heart long term, versus if you do a stent, then down the road you need another stent, down the road you need another stent. The squeeze of the heart can weaken over time versus a bypass. So that's the advantage, but the huge disadvantage that everyone recognizes, it's a big operation. It's a massive operation.
Sure. Gotcha. So you pay me now or pay me later.